Hello, I'm Dr. Elizabeth Racz.
And I'm Dr. Christine Mathews.
And we are here from SD Minds to talk to you today about COVID vaccinations. I am an infectious disease surveillance specialist.
And I'm an infectious disease epidemiologist with a specialty in microbiology and immunology.
We're going to bounce a few questions back and forth that we get all the time as epidemiologists. And so we thought we would bring those to you today to help you make some of your own decisions. The COVID vaccine seemed to come out quickly, rushed even. Are they really safe? And what side effects are there?
That's a great question. So I've been hearing a lot of questions that people have been asking about safety in this past year. One of the concerns that people express is that they've never heard of mRNA vaccines and that there are no FDA-approved mRNA vaccines, or at least have not been on the market prior to COVID. One of the reasons for this is that mRNA vaccines have actually been in development for the better part of 10 years now, but they were being developed by companies looking to target very complex diseases such as cancer. So the big difference between cancer and an infectious disease is that in an infectious disease, there's an easy answer to the reason why it's causing illness, whereas cancer is very multivariable and complicated. So they worked on these vaccines for a very long time, but the nature of the disease made it so that it was just complicated and nothing had ever been brought to market. The advantage is that all of the components that go into the mRNA vaccines in particular have been thoroughly tested in safety studies and clinical trials for many, many years. So when COVID occurred, there was a good opportunity to use that technology they had been working on and apply it directly to creating a COVID vaccine. And so it was released very quickly to our benefit. That didn't mean that it did not go through a proper channel of scientific study. Dr. Racz, here's a question that I've heard quite a bit from individuals. The COVID vaccine is not 100% effective at preventing you from getting sick. So if it's not completely effective, why should you get the COVID vaccine in the first place?
No vaccine is 100% effective, but some coverage is better than no coverage at all. We know that the vaccinations that are taking place now, the vaccines that we have, are preventing people at very high rates in the 90% and up level from going into the hospital with severe illness and possibly even protecting people from death.
Do you think that the risks of the vaccine and the side effects are worth it in order to protect yourself against COVID?
I do think that the temporary side effects from the vaccine make it very worth it to get the overall protection from the vaccine. Even if you only have one of the shots, you at least have some coverage, some protection from the Delta variant, from the Alpha variant of the SARS-CoV-2 virus. Now, a lot of the side effects that we have talked about include fever, fatigue, illness, and in very rare cases, there are long-term effects, but the pros really outweigh the cons. This is from someone who is wondering, and I get this all the time now that the Delta variant is out, they're wondering, what is the Delta variant? And is it really any different from the first COVID, the Alpha COVID?
That's a great question. Again, another one. So the original SARS coronavirus 2 that emerged last year is what we refer to as the Alpha variant. It's the original kind of variant that was circulating. Now, what happens with viruses and their genetics is that as they're circulating and as they are replicating themselves in human hosts, sometimes there is a statistical probability that they can have a change in their genetic information. We call these mutations. You can also call it an error. Some of these mutations are harmful to the viruses. Some of them really don't change them at all. But every once in a while, there's a statistical probability that a mutation is going to actually make it easier for a virus to either get into a person, to replicate in a person, or get out of a person. And that's what we've seen with these new variants that have emerged. And the big one that you might be hearing about is the Delta variant. The Delta variant has emerged as a mutation which occurred in one very small specific location in the coronavirus structure. But what it's allowing it to do is that it is more easily transmissible. It spreads more easily. It's harder to be able to stop, especially even with things like masks, especially if you don't have appropriate masks. It makes it more likely that the virus can get through because it's more transmissible. We also see that there are even some breakthrough cases of the Delta infections, even in individuals who have been vaccinated. And something that's important to understand is the more a virus gets to replicate in a population, the more that there's a risk that this can happen again.
Right. And I think that's a wonderful point to touch on is we don't want the spread to continue because although viruses aren't alive, they're replicating. And as part of their replication, these mutations can occur. And as Dr. Mathews just pointed out, this could lead to sometimes a negative end result for us. And we really want everyone to get vaccinated so we don't have more opportunity for that virus to change and maybe break through our vaccine coverage that we do have.
So speaking of protection with the vaccine, Dr. Racz, if I've already received my COVID vaccine, how long can I expect that protection to last?
If you've had both shots of your COVID vaccine, you should expect your coverage to continue on for about 6 to 8 months. There has been a recent announcement to get boosters at about 8 months, just to make sure you have that strong immune response when confronted with SARS-CoV-2, the virus that causes COVID-19, either variant.
So if I've had all my COVID shots in the past, I should probably be keeping an eye out for getting a booster sometime in the next coming year.
Correct. Within 8 months of 2 weeks after the date of your second shot. If I get COVID, how long until I can get vaccinated?
You would want to talk with your physician, but right now the current guidelines say that if you have had coronavirus, you need to wait at least 90 days before you can get your vaccine. The reason for this has to do with your immune response. When you get sick, you're creating an immune response, but you want your body to come back and make a stronger immune response by getting a vaccine. And so you don't want that immune response from being sick interfering with your vaccine. But speak to your doctor to make sure you get the timing just right for your situation. Dr. Racz, speaking of COVID vaccines, if you have already had COVID, why would you even want to get a vaccine? You've already had COVID, right? So why get a vaccine?
If you've already had COVID, it's still important to get vaccinated. If you've had COVID Alpha or Delta, right now, what we know is that your immunity does not last for the rest of your life. You don't just get COVID and then you're good. Okay, so based on the science, your protection lasts for give or take about 90 days. For some people it's more, for some people it's less. So what you want to do is make sure you talk with your doctor, your physician, and get that vaccine as soon as you're able.
So what you're saying is that if I had COVID previously, I could get COVID again in the future, especially if I didn't get a vaccine?
Absolutely, you could get COVID again.
Okay.
Especially with the Delta variant and potentially other variants down the line. Here's when I can't get vaccinated. Can't I just rely on those around me to be vaccinated?
So this comes back to a common idea that we see circulating called herd immunity. The idea is that you have vaccine rates that are high enough in a population that they can prevent the transmission of a disease. Now, every disease has a different threshold for herd immunity, and it kind of depends on things like transmission factors, the health of the population, and a variety of things. Roughly speaking, for coronavirus, for the Alpha variant specifically, so for the original one, we were looking at vaccine threshold rates of about 80%. What this means is you would have to have about 80% of a population who had been vaccinated and also still had sufficient immunity to prevent transmission. For the Delta variant, we suspect this may be actually even higher. So one of the reasons we encourage individuals to get vaccinated is even if you don't think it's necessarily just for you, if you're not worried about you getting sick, there are individuals who medically cannot receive vaccines. And in order to protect them, the entire community has to be protected enough to prevent that disease spread and transmission. If people say, I've had my vaccine, I'm not worried, I want to get back to life as usual, I'm done with this pandemic, What do you have to say about that? What are your thoughts and feelings?
So if you've had your vaccination already, I applaud you. If you've only had one, get your second. If you haven't gotten one yet, get them both, get in line. But we still have to take care of those around us. Children under 12, people who are immunocompromised, and people who can't have their vaccination for various other health reasons, allergies, etc. Right? So what we need to have happen here is, as Dr. Mathews was talking about, is to get enough of the population vaccinated and to get enough people protected against SARS-CoV-2 that we do have a stop to community spread. So we have a stop to the replication of the virus. And so that the virus cannot mutate and we don't have to deal with yet another variant that could potentially bring us back to square one with the vaccinations. We want to make sure we are protecting those around us. We want to be the person who helps your neighbor out.
And just as a reminder, there are still individuals who are dying daily from coronavirus. As much as we all wish that this pandemic was over, the reality is that we are not through this at this point in time. We understand that people may be very overwhelmed and tired, frustrated, scared. If you have questions or concerns, we encourage you to reach out to experts. If you have specific questions relating to coronavirus or vaccines, please feel free to reach out to Dr. Racz or myself. If you have medical questions, particularly about your own medical situation, please talk with your medical practitioners so that you can be better informed and be able to make decisions for yourself.
And I would just like to throw out a closing thought and just take a moment. Please remember that the virus is not alive. The virus is the enemy. And that is what we have to address with our preventative actions, with the vaccine, with other prevention methods that are quite simple: hand hygiene, social distancing when possible, and even masking has been highly proven to be effective. Thank you very much for taking some time to really consider whether or not vaccination is right for you. It's so important right now that you take a moment and sit with yourself and make your very own decision. Thank you very much.